Hi, my name's Jamie Wood and I'm a physiotherapist from Western Australia. I'm making this video on behalf of the Precision Recovery Initiative at Mount Sinai Hospital, and today I'm going to talk to you more about the Huffing Technique. In the last video I taught Sam the active cycle of breathing techniques, of which huffing is a component, and huffing is used amongst all of the airway clearance techniques as a way to get the airway secretions high enough in the airways so you can cough and clear them much more easily and effectively. So a good way to think about how to do huffing is from a top-down approach. So O-shaped mouth, open upper airway or the back of your throat, relaxed upper chest and shoulders, and then using your stomach muscles to push the air out. And a good analogy is like fogging up a mirror. The sounds that you're listening for when you huff are the sounds of the airflow coming out and the crackles of the secretions moving within your airways. And what you want to avoid is the sound of wheeziness, which is your airways closing down. And what will cause a wheeze is too much effort or too much force. And then you definitely do not want your huff to lead into a cough, because that'll just turn into a coughing fit and you're just squashing your airways down, and this is counterproductive to what you're trying to achieve. Huffing is usually done in a set of at least 2 or 3, and once you get good at huffing, you can also huff at different lung volumes to move the secretions from your smaller airways, your middle-sized airways, and from your larger airways. So just to refresh Sam, I'll get you to do one huff. So take a medium breath in, make an O shape with your mouth. Keep the back of your throat open, relax your upper chest and shoulders, and just use your stomach muscles to push the air out. Good. Try one more with a more rounded O shape of your mouth, and just think about using your stomach muscles more. Good. So the reason that huffing is so important is that after you've done the cycle of technique that you're doing, you've started to loosen up the secretions in your airways, but you need to move them high enough in your airways so that your single cough can clear them effectively. If they're still in your smaller airways or even some of your middle-sized airways, coughing won't actually clear them from the back of your throat, and you'll find that you have to cough and cough and cough. Huffing is better than coughing because it uses less energy. It doesn't make you feel unwell from having a headache, or some people vomit when they cough too much, and it's also much better for your pelvic floor. So now, Sam, I will show you how you can huff a different lung volume. So when you use different volumes, it's about the air that you breathe in before you huff. The huffing technique is exactly the same. You always start by trying to move the secretions from your smaller airways up, so you take a small breath in before you huff. So just try the same huff with a smaller breath in. Good, and remember to make an O shape with your mouth. Think about fogging up a mirror. Good. Take a break. Never do more than 2 or 3 huffs in a row, because it can become tiring and make you lightheaded. And you also need to let all of your breathing muscles settle down and relax before you move on to the next part. So Sam has done 2 huffs at a lower lung volume, so she can decide whether she needs to do another huff at that lung volume, or whether the secretions have moved higher and she can do the next 2 or 3 huffs with a medium breath in. So Sam, I will get you to now do 2 huffs with a medium-sized breath in before you huff. Good. Think about using your stomach muscles to push the air out. Good. And just do one more. Good. Now take a break. So what Sam has done is 2 huffs at a lower lung volume to move the secretions from the smaller airways, 3 huffs with a medium-sized breath in to move it from her middle airways higher, and now you'll generally start to feel it in your central airways, so you can do huffing with a deeper breath in to get it to the back of your throat, where you can cough and clear it much more easily. So do 2 huffs now, Sam, with a deeper breath in. Good, and so remember, it's the same type of huff, it's just the amount of air you breathe in before you huff. Good. Now take a break. Always relax for a few moments before you cough. This is what we call a directed cough. So you're coughing when all of your airways and your breathing muscles have settled down, so you can control it, get a lot of air in before you cough, and make it much more effective. Sam, now I'll get you to take a deep breath in and have a nice strong cough. Good. So there I have shown you huffing at different lung volumes. You can use this to really effectively move the secretions that you've loosened with your airway clearance techniques all the way up to your central airways so that your cough can be much more effective. I gave you some benefits before, but the most important thing about this is that it will minimize coughing and save your energy, especially when you're tired from doing all of these techniques. Thank you.